I'm Michelle Marks, and I'm the Executive and Research Director of Setting Scoliosis Straight and the HARM Study Group. Setting Scoliosis Straight is helping to improve patients' lives with spinal deformities across the world. They're supporting the research efforts of the HARM Study Group that's answering important clinical questions, but they're also focused on providing evidence-based information to patients and their families so they can really make informed decisions about their care for scoliosis. I've been with the organization for over 20 years, and I've seen it evolve from a small group of collaborative surgeons into an incredible research organization that's really improving care for patients.
My name is Melody Dick, and I'm a research assistant. I handle the imaging and radiograph measuring, as well as other health-related quality of life tools.
My name is Mary, and I am a program manager at Setting Scoliosis Straight. I work on a quality improvement initiative called the Surgeon Performance Program, which we use to provide surgeon feedback to doctors all around the world so they can see how they do in their operative cases compared to other peers who would be other participants of the program.
Hi, my name is Heather Garesto, and I work in quality assurance at the Setting Scoliosis Straight Foundation. I work to make sure that data is entered accurately and in full to allow us to better assess patient outcomes. The data we collect allows us to see how patients are doing a year out from surgery, 2 years out from surgery, all the way up to 10 and 20 years out through surgery.
I started my career as a physical therapist and was improving patients' lives just by treating them. But when I realized how much research can really impact patients' care, not only now, but in the future, I was focused and inspired to work with an organization such as the HARM Study Group and Setting Scoliosis Straight.
What inspired me to work at Setting Scoliosis Straight is the impact that the foundation has on the community. I always wanted to work in an area where I could give back and help others, and of course a nonprofit organization is the best way to do that.
I was inspired by the opportunity to work at Setting Scoliosis Straight because I have family affected by scoliosis, and I wanted to help contribute to the advancement of treatment and improve outcomes for patients living with scoliosis.
What inspired me to work for Setting Scoliosis Straight is the fact that my family on both sides has been affected by this deformity. So 20 years ago, my husband went through the procedure to have spinal fusion, and there was not much education or avenues for education during that time. So my main inspiration was to help aid in any way I can education for patients and family members of patients so that they can get the answers that they need in a very difficult and life-changing time.
Setting Scoliosis Straight is supporting the efforts of the HARM Study Group, whose research is advancing care for patients with spinal deformities across the globe. Without your generous donation, our research would not be possible.